Hello, I'm Dr. Kaylin Lane. I'm a psychiatrist currently practicing in rural South Georgia. I'm board certified in general psychiatry, child and adolescent psychiatry, and forensic psychiatry. I currently work as the medical director for Unison Behavioral Health. Unison is a community service board based in Waycross, Georgia. We provide services to individuals with mental illness, substance use disorders, and intellectual and developmental disabilities. In addition to serving as medical director, I also provide direct patient care to our clients. This is done almost exclusively via telemedicine or telehealth. Today I will be discussing autism spectrum disorder and the importance of early intervention, assessment, and treatment. So why do we call it a spectrum, autism spectrum disorder? Because, as Dr. Stephen Shore said, if you've met one person with autism, you've met one person with autism. Many individuals are on opposite ends of this spectrum. On one end, you may have individuals who are nonverbal, severely developmentally delayed, and even intellectually disabled. And on the opposite end of the spectrum, individuals who have IQs in the superior range, no language or other developmental delays at all. In mental health, we use the DSM-5 to define mental conditions. This is the Cliff Notes version of DSM-5 diagnostic criteria for autism. Criterion A, deficits in social communication and social interaction. This might include deficits in social emotional reciprocity. These are individuals that talk to you or maybe at you, but not really with you. Deficits in nonverbal communicative behavior, including eye contact and facial expressions. Deficits in relationships, peer problems, marital problems. Criterion B, restrictive, repetitive patterns of behaviors, interests, or activities. Movements, the use of objects or speech, including hand flapping, lining up toys. Echolalia, which is basically repeating back or parroting back what someone else says. And scripting, which is often used to refer to the repetition of phrases or even entire conversations from TV shows or movies. Insistence on sameness, almost OCD-like behaviors, rituals, routines, obsessions, fixations, and interests. And number 4, sensory issues. So that's how we define autism. How does it actually present in the real world? Or at least in my world, as a child and adolescent psychiatrist. I often hear from parents that they knew something was wrong or that they knew something was different within the first year of their child's life. Individuals with autism, as babies and young toddlers, are often fussy. They may cry all the time. They sometimes don't want to be held or comforted or cuddled. Sometimes I hear the opposite of that. I'll hear from parents, "Oh, he was the best baby. He never made a peep." Individuals with autism often have sensory intolerances. They may have difficulty tolerating certain types of clothing. They may be particular about their socks and their underwear, tags in the back of their clothing, that type of thing. Many of them are also very sensitive to food textures and certain noises that many of us would not give a second thought to, including laughter or even the noise of someone chewing or breathing. Many individuals with autism exhibit traits of OCD, or obsessive compulsive disorder. They may line up their toys or arrange their toys in a particular way, often becoming very distressed if anything is moved out of place. They're often very intolerant of changes, whether it be changes in their routine or schedule, or even changes in their environment. If a parent moves a piece of furniture or redecorates a room, this could cause severe distress. Individuals with autism sometimes are overly interested in things that one might find odd. For example, I once had a 3-year-old patient who was obsessed with lawnmowers. Not just looking at them or pretending to mow the lawn, but actually talking about the different brands of lawnmowers, different manufacturers, and what made one better or worse than another. I treated another young lady when she was in her teens, but her mother told me that at the age of 5, she had decided she wanted to buy her own home. So she started collecting real estate magazines anywhere they went. She was very distressed when she contacted the bank to learn she could not open her own account. Another thing I've found is that girls often fly under the radar, but puberty can be a tipping point for them, leading to clinical presentation, including depression and anxiety, and an eventual diagnosis of autism. So as parents, in order to identify what's atypical or unusual or abnormal, we need to know what's typical, what to expect, what should we see, what is, quote, normal. So there are typical developmental milestones that are very important to know and to understand. By the age of 3 or 4 months, an infant should watch faces with interest and be able to follow moving objects. They should recognize familiar objects and people and smile at the sound of your voice. They'll begin to develop a social smile and be able to turn their head toward sounds. By the age of 7 months, infants can respond to other people's emotions. They often enjoy face-to-face play and can find partially hidden objects. For example, a toy that's partially covered by a blanket. They explore the world with their hands and their mouths, and they'll struggle to reach something that's just out of their reach. They'll respond to their own name, and they use their voice to express joy and displeasure. They'll babble chains of sounds, ba 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 da 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 ma 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 ma, that type thing. By 1 year, children enjoy imitating people, and they'll even try to imitate sounds. They enjoy simple social games such as, I'm gonna get you. They explore objects, and they can even find hidden objects. They respond to no. They use simple gestures, such as pointing to an object that they want or that they're interested in. They should be able to babble, but with changes in their tone, and they may use single words such as dada, mama, or uh-oh. They turn to the person who is speaking when his or her name is called. 2-year-olds frequently imitate the behavior of others, and they're often very excited about the company of other children. They should understand several words and be able to find deeply hidden objects. They should be able to point to some named pictures and objects and begin to sort things by shape and color. They should begin engaging in simple make-believe play. They should be able to recognize the names of familiar people and objects and follow simple instructions, although not always 100% of the time. They should combine 2 words to communicate with others, such as saying, more cookie? By 3, we expect that children should express affection openly and have a wide range of emotions. They should be able to make mechanical toys work, play make-believe. They should be able to sort objects by shape and color and match objects to pictures. They should be able to follow a 2 or a 3-part command. Again, they may not always do this 100% of the time. They should use simple phrases to communicate with others, such as go outside, swing. They should use pronouns, I, you, me, and some plural words such as cars, dogs. Again, they may not always use these correctly. By the age of 4, we expect that children are able to cooperate with other children, at least to some degree, and that they're increasingly inventive in their fantasy play. They should be able to name some colors and understand concepts of counting and time. They generally speak in sentences of 5 to 6 words. They start to tell stories and should be able to speak clearly enough for even strangers to understand. They should be able to follow 3-part commands and understand the concept of same and different. By 5 years of age, most children want to be like their friends. They enjoy singing, dancing, and acting. They should be able to distinguish fantasy from reality and know the difference between real and pretend. They should show increased independence and be able to count 10 or more objects and correctly name at least 4 colors. Most 5-year-olds speak in sentences of more than 5 words and often tell longer stories, sometimes quite long. So now we're going to talk about the prevalence of autism. Current estimates are that 1 in every 54 children could be diagnosed with an autism spectrum disorder. The CDC's Autism and Developmental Disabilities Monitoring Network estimates that the prevalence of autism is currently 1 in 54. I'm going to go back to the previous slide momentarily. It's important to note that the current report, the 2020 report, is based on data from 2016. So what we know at this point is that as of 2016, the prevalence was 1 in 54. As you can see from this illustration, the prevalence of autism is increasing. Currently, approximately 1.5% to 2.5% of children have autism, and those estimates are roughly 3.5% of boys and 1.2% of girls. So conceptually, you can think that autism is roughly 3 times more common in boys than in girls. And according to the DSM-5, it remains unclear whether the higher rates of autism reflect an expansion of the diagnostic criteria, which now include subthreshold cases which previously would not have been diagnosed, or whether the higher rates are related to increased awareness, differences in study methodology, or possibly a true increase in the frequency of autism spectrum disorder. This is a quote I like about the autism gene. So Dr. Temple Grandin said, "What would happen if the autism gene was eliminated from the gene pool? You would have a bunch of people standing around in a cave, chatting and socializing and not getting anything done." So the big question is, what causes autism? And the answer is, like most medical problems, we don't entirely know. However, what we do know is that there are certain risk factors for autism. Certain environmental risk factors may include advanced parental age, parents who are older at the time of conception, low birth weight, including babies that are born extremely premature, or babies who are a result of multiple pregnancies. Fetal exposure to Depakote is also a risk factor for the development of autism. Pregnancies spaced less than 1 year apart is another risk factor, and there are likely many other environmental risk factors that we don't know. Of note, prenatal vitamins with folic acid, when taken prior to conception and throughout pregnancy, are thought to reduce the risk of autism. There are certainly genetic components to autism, and when you look at studies, the concordance rate between twins, identical twins, show that there's a heritability in autism. Estimates are anywhere from 37 to over 90%. And there are likely multiple genes involved. So there are very few things that I think are important enough to really pause and repeat. And this is one of those things that when I say it, I often say it 2 or 3 times in a row because I don't want anyone to miss it. What we do know is what does not cause autism? Vaccines. Vaccines do not cause autism. This is a link to Autism Speaks, which I would encourage you all to visit. When it comes to the assessment of children with possible autism, in a perfect world, we'd include evaluation by most, if not all, of these professionals: occupational therapists, physical therapists, speech and language pathologists, ABA-trained psychologists, a child and adolescent psychiatrist, their primary care doctor, a developmental pediatrician, a pediatric neurologist, and possibly even a geneticist. And the assessment would include input from parents, relatives, caregivers, as well as school or daycare staff. However, in the real world, we may need to get creative. Access to timely assessment by specialized professionals may not be readily available. Babies Can't Wait or comparable early intervention programs typically do provide speech therapy, occupational therapy, and physical therapy for children ages 6 to 36 months. A list by state can be found at the following website. As I said, in the real world, to assess individuals for autism, we have to get creative. We need to take advantage of what is available and what's already readily accessible online. This includes telehealth services to get assessments and treatment if needed, access to parent education videos, and training videos to teach parents parent-mediated interventions. Parents can also access a rating scale called the MCHAT, which can be used for children ages 16 to 30 months, and it's available in multiple different languages at the following link. So, a few take-home messages I'd like to share, and this is coming from a child and adolescent psychiatrist who is also a parent of a 6-year-old. As soon as you have concerns about your child, or your friend's child or your relative's child. Talk to the child's primary care doctor or pediatrician and request further assessment. Trust your gut. If you think something is wrong, say something. Don't take a wait-and-see approach. If you feel as though your concerns are not being taken seriously or are not being addressed in a timely manner, seek a second or a third or a fourth opinion until you're able to get an assessment done. The earlier a problem is identified, the better. When it comes to treating individuals with autism, John Elder Robison, who's an author, said our duty in autism is not to cure, but to relieve suffering and to maximize each person's potential. So as a child and adolescent psychiatrist, these are some of the symptoms that autistic individuals often experience that may require treatment. These could include irritability, tantrums, and even aggression, self-injury, symptoms of ADHD, depression, anxiety, insomnia, social communication problems, pica, which is the consumption of non-food items, such as ice, dirt, clay, etc., psychosis, and sensory issues. Our hope is that with early intervention and early treatment, individuals will be able to avoid developing some of those symptoms and perhaps never make it to my office. Treatment for individuals can be both non-pharmacological as well as pharmacological, meaning it can involve medicines or no medicines. So, non-pharmacological interventions include ABA, or Applied Behavior Analysis, which is sort of the gold standard treatment for autism. Additional help can include communication supports, such as speech therapy, ASL, or American Sign Language, picture boards, or even visual schedules. Cognitive behavioral therapy can also be very helpful for individuals with autism. It can help in treating autistic and non-autistic individuals with common mental health conditions such as depression and anxiety. Additional therapies can be helpful in teaching social skills and social cognitive training and life skills. Occupational therapists can also be quite helpful with sensory interventions for those individuals who have severe problems with sensory intolerance. Physical therapy and occupational therapy can help motor delays and motor coordination problems. And of course, treatment of physical medical problems is key. If a child is in pain, they'll often show it in their behavior. And then of course, family interventions, including parent-mediated interventions, can be very effective. Other possible treatments that I'd like to mention include herbal, homeopathic, naturopathic, or alternative treatments and diets. Currently, there is little evidence supporting these, except for the use of melatonin for sleep. Many of these possible treatments do seem relatively harmless, however, they may require effort and expense that might be better used for evidence-based treatments. Ongoing research will hopefully help us learn more and provide other possible treatments in the future. This is the second slide that I'd like to really stress is a key take-home message here. There are certain treatments which should not be used in an attempt to treat autism. These include chelation, hyperbaric oxygen treatment, secretin, and stem cell reimplantation. The reasons they should not be used are that they do not work, they're expensive, and they may pose serious health risks, including death. I want to take a minute to just remind everyone that individuals with autism are always unique, totally intelligent, and sometimes mysterious. I want to thank you for your time. I hope you found this presentation helpful. And if you don't remember anything else, please remember, time is brain.